Good afternoon, and thank you for joining us for today's Nevada Immunization Learning Exchange webinar. I am Brianne Van Dyke, Program Director for Immunize Nevada, and I will be today's moderator. Before we get started, I'd like to review a couple of housekeeping items. First, if we should become disconnected for any reason, please log in again and we will continue where we left off. Second, please locate the Q&A box at the bottom of your screen. If you have any questions today, please type them there and we will address those at the end of today's presentation. Additionally, if you are interested in claiming continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar is ended, as well as be posted in the follow-up post-webinar email. All CEU certificates will be emailed out within the next week. Please note today's webinar is being recorded. The archived presentation and slides will be available on immunizenevada.org/NILE-webinars as well. Before we officially begin, I'd like to provide a little disclaimer. Immunize Nevada's NILE webinars are made possible by the generosity of speakers who donate their time and expertise to benefit the coalition. The expectation and goal is for community partners to gain knowledge on immunization and infectious disease-related topics through a non-branded, unbiased presentation. I'd like to now turn it over to today's featured presenter, Dr. Sheila Palevsky, a primary care pediatrician with a long history of academic and public health experience, and whose work and role with the American Academy of Pediatrics Visiting Immunization Expert Initiative has brought her here today. Welcome, Dr. Palevsky.
Thank you so very much. It's really a pleasure to be here with you all today. So as we start, we're going to be talking about vaccines and trying to address some of the issues related to vaccine hesitancy. Next, please. As was mentioned, I'm here through an initiative from the American Academy of Pediatrics, and the goal of this is to help physicians and practice staff be able to make strong recommendations specifically for human papillomavirus and pediatric influenza vaccination, but of course it runs to all vaccines. And these are supported by funding from the CDC and Department of Health and Human Services. All of the comments are my opinion and have been reviewed by the Academy of Pediatrics. Next, please. I have nothing to disclose. I have no conflicts of interest. Next. And there are some learning objectives here that I will let you look at as you wish later on. It should be obvious as we move forward. Next, please. I will say that I'm going to leave enough time, I hope, for questions and discussion at the end. I'm going to say right off the bat that I am biased. I love vaccines, but it's not vaccines that are the important thing. Vaccines need to get into arms, or for little ones into the leg, or into the mouth. It's not vaccines that save lives, it's vaccination that does. And old data worldwide, vaccination prevents 2 to 3 million deaths each year, and this is not talking about COVID. And in the pre-COVID era in the United States, vaccination prevents at least 42,000 deaths per birth cohort. So they really are a major medical advancement. Next, please. When we look at how well we do here in the United States with getting vaccines into kids, and this is some data that looks at from the National Immunization Survey for the period 2017 to 19, and this only looks at getting at least 2 doses of influenza into children by 2 years of age, by 24 months. And if a child is 2 years old, they really ought to have had at least 3 doses or 4 doses, depending upon when their birthday is. You can see, and I've labeled Nevada as a state here. that Nevada is not doing as well as we might like with getting children vaccinated for influenza. And this is probably reflective of getting vaccines on board for all vaccines as well. Next, please. This is a very complicated slide, and I don't want to confuse you with it, but this looks at the percentage of children in kindergarten who are fully vaccinated with MMR, with measles, mumps, rubella, as compared to, the percentage who are either under-vaccinated and non-exempt. That means they don't have a reason to not be vaccinated by state. And I've highlighted Nevada on the bottom of the slide, towards the bottom of the slide. And you can see that in the period 2018-19 compared to 2019-20, the dark bar on the left for Nevada is the change in MMR coverage, and that went down. And the light color to the right is the change in non-exempt under-vaccinated kids. And that didn't go up very much. Whereas if we look, say, at the very bottom of the graph, and that's Indiana, that bar did go up. So the point of this is that over the past years, again, pre-COVID, we've seen immunizations fall off, and this is MMR for kindergartners. Next, please. So what those two slides really speak to is that we're not doing as well as we want, and in the current environment pre-COVID, vaccine coverage was declining in many parts of the country. And COVID has put a new spin on all of this. Kids are missing vaccinations because of COVID, and missing vaccines puts both children and communities at risk. Next, please. This is data coming from Blue Cross Blue Shield. I have no connection with them, but it's a useful slide. And this looks at the decline in vaccinations between January and September of 2020. And there was a substantial decline in routine vaccines, an estimated 9 million doses to have been missed by the end of the calendar year. And not getting vaccines into kids increases risks of these vaccine preventable diseases and makes communities at greater risk. Next, please. And we know that these are very challenging times. We know that vaccination is an essential medical service for all children and teens. And ideally, we'd like to do these in the medical home. That's not always how it's done everywhere, but as a pediatrician, that's what we would like. We also know that there's been a decline in preventive healthcare services over the past 15 months that's slowly beginning to correct itself. And we need to stress and focus on the need for all preventive services. And when children do get to the office for vaccines, we want to administer all vaccines that are due or that might be overdue at the same time and at that same visit. And what I'm alluding to here is there are some places where they make rules that are not based in anything, that you can't give more than 2 vaccines at a visit. And that really is a disservice. We want to give all vaccines that are due at the same time, at the same visit. I realize sometimes that means that we feel as though kids are becoming pincushions. but biologically children can respond to all those vaccines, and it really is the right thing to do. There's no contraindication to that. And we need to implement strategies to get kids caught up on vaccines, particularly the youngest children, the ones who are most vulnerable. And we do that using all sorts of reminder recall systems. And in these challenging times, we want to ensure safe delivery of vaccines. We may need to use personal protective equipment. Where I am, and I know that around the country, the rules are all changing. In medical offices, everyone is wearing masks all the time. And physical distancing in the office, we're not having clusters of people sitting on top of each other in a waiting room. Next, please. And as we're planning on school reopening for the fall, we need to remember that lots of school-age children missed their recommended vaccines because of COVID-related disruptions. We know that many schools that have been working with remote learning have not necessarily focused on compliance with school vaccination requirements. And even those where kids are in person, there's been, in many places, a laxity about those compliance rules. And we know that COVID-19 vaccine is now available for those 12 and older, and it is being urged for a safe return for school. The Academy of Pediatrics supports co-administration of routine and/or overdue vaccines at the same time with COVID vaccine. There need not be any waiting between those vaccines. And this is new guidance from the CDC and the AAP as of last week. Admittedly, we do not yet know when COVID-19 vaccine will be available for children under the age of 12. But we do need to get kids caught up on vaccine doses that they've missed, get them caught up now so that they can safely return to in-person learning and not risk spreading the other more common childhood diseases when they're in school. Next, please. Now, we want to talk about vaccine hesitancy. This is not something that is new. Vaccine hesitancy has been around since vaccines have been around. Next, please. This is a cartoon from 1802, so from 200 and almost 20 years ago, 219 years ago, that it's now in the Library of Congress in Washington, DC, but this cartoon satirizes people getting cowpox, smallpox vaccine. Edward Jenner, the guy standing in the brown suit coat, is inoculating the woman sitting in that armchair, and you can see the people behind her who have already been vaccinated in this cartoon having bovine features, because the allegation was that if you got smallpox vaccine, you would turn into a cow. Next, please. Now, the reality is that we hear a lot of vaccine hesitancy and anti-vaxxer news in the media, on social media, but at least for routine vaccines, the vast majority of parents vaccinate their children or have their children vaccinated. So this was published in 2020. And this is the percent of children born in the 2016-17 years. So these children are now 4 to 5 years old. And these are kids who received their vaccines by 2 years of age. And you can see that the vast proportion of them, almost 99% of parents do vaccinate their children. The problem is it may not be on time. Next, please. And when we talk about parental attitudes towards vaccine, it's a spectrum. On the right here, we have immunization advocates, people, parents who are absolutely in favor of vaccines, who will even talk them up. This is where, I would be. I'd be way off the chart on the right-hand side. I really believe in vaccines and I would be advocating for them. In the middle, we have some who are health advocates. We have some who, well, they'll do what they're told. They're happy to, listen and take advice. Then we have the folks who are sitting on the fence and need some information. As we move more towards the left, we have the people who are worried, but you can have a conversation with. And then off the chart here, all the way to the left, would be the ones who don't even want to engage with you, the true anti-vaccine folk. Next, please. And this is another way of looking at the same thing. This looks at it, and I've tried to use color. The green on the left here are the acceptors, the ones who are pro-vaccine. They have relatively few vaccine concerns. They're going to ask questions. Their children are fully immunized and immunized on time. They have trust in their pediatrician, their provider. They're interested in vaccine information, and those children get vaccinated. On the far right, we have the rejectors. They're not interested in most vaccines, but there might be one or two that they will accept for whatever reason. Generally speaking, their children are or profoundly under-immunized, but we'll call them unimmunized. They don't have trust in their provider, their pediatrician, their nurse practitioner. They're not interested in learning anything from or getting information from their clinician. And this is that about 1% or under 1% group. And then we have the vaccine hesitant. And these are the ones who are unsure or delay or pick and choose. Their children are typically under-immunized. They're generally interested in talking with somebody who's trustworthy as a health professional that they can have an exchange with. They're interested in getting information from their child's health professional, and we should really be focusing on this group. And all of this is influenced by a whole myriad of things: complacency, convenience, context, the individual place, the individual vaccine, but it does assume that vaccine services are available to those families. Next, please. And so we often use something that, if we have to describe, we call motivational interviewing. This makes it sound much more complicated than it really needs to be. This is a patient-centered method to try to enhance the intrinsic motivation that somebody has to change their health behaviors by helping explore what those concerns are and helping the individual to resolve their ambivalence. Now, we've used these for things like substance abuse and oral health and for diet and exercise, and it's been very efficacious. And so now what we're doing, if you will, is adopting and adapting these kinds of tools to address vaccine hesitancy. Next, please. So what do? We ask open-ended questions. I hear that you're concerned about getting Junior vaccinated. Can you tell me about it? We're going to listen, and reflective listening is saying back, I hear you saying that, and rewording it and asking if that, am I understanding you correctly that you're concerned about? We try to elicit the advantages and disadvantages of change as the family sees it. We try to ask about the importance and confidence of making a change. And we try to summarize the conversation. And we do these things lots of times in lots of other arenas. And what we're trying to do now is to move this into asking about vaccine hesitancy. Next, please. And what we do know is that a strong clinician recommendation, and when I use the term clinician here, it's whatever health professional or allied health professional we're talking about. So if the medical assistant says, I know how important these vaccines are, if the pharmacist says, this is really important, if the health educator says it, these are the best predictors of vaccination. And of course, I'm a pediatrician. We want to hear this coming from the clinician, the person who can write the order, if you will, for that vaccine as well. Next, please. And so using that, the ability to, or the initiation of vaccination series really depends upon that high quality recommendation. If I were to say, well, there's a vaccine out there and, you can get it if you want it, that doesn't really say anything. So if I were to say, and I'll use HPV vaccine, well, HPV vaccine is available. Do you think you want it for your teenager? That's not going to encourage vaccination. If I were to say it, well, I have the HPV vaccine here and lots of my patients get it. Do you want it for your teenager? That doesn't do a whole lot better. But if I were to say, today, your child is eligible to get your HPV vaccine. Today, we're going to do the Tdap, the meningococcal, and the HPV vaccine. And they're all really important. And I'm planning on, we're all set to go ahead and give these vaccines to your child. We want to have that recommendation the same way we would recommend a tetanus booster, the same way we would recommend a meningococcal vaccine, the same way and the same day, not I'm going to come back and do it in a month. So a high quality recommendation. Next, please. Now, we need to remember that parents and physicians, parents and health professionals may speak different languages. And again, here I'm using the word physician. I know that you are allied health professionals or non-physicians in the vaccine world, and it applies to you as well. And I don't mean that your patient may speak Portuguese and you don't, or your patient may speak French and you don't. I mean that we may speak a more technical or scientific language, and parents are speaking an emotional language. Next, please. And so when we frame that message about vaccines, we need to talk about concerns, beliefs, values, priorities. It may be the sociocultural context, and it may be the language that we use, again, both the English, French, Spanish, Navajo, what have you, and science, emotion, vernacular to be able to be sure that we're getting that message across. Next, please. When we talk, our goal is to persuade. It's not to win a debate. We're trying to bring people along. You don't need to correct every erroneous idea. Now, belief is always going to win out over science. Belief is stronger than proof. And as an example, I will tell you that there is still a flat earth society, people who believe that the earth is shaped like a platter, and when you come to the edge, you're going to fall off. And these individuals believe that the pictures that astronauts have taken from outer space are phony. And you can't convince them otherwise. These beliefs won't and can't be changed by evidence, but you can try to work within their world and persuade to try to get them to come towards the goal of getting, in our case, getting vaccinated. Next, please. We need to be aware that just because there's good information, it doesn't reliably instill accurate beliefs. I can cite data all the time, but that doesn't help people, particularly people who don't speak data language and are skeptical of scientific information, particularly when that skepticism contradicts their existing beliefs or predispositions. And this is particularly true when the issue is related to their identity. If an individual or a family lives in a community where everybody feels the same way, I can't speak negatively of their entire community because it's not going to help persuade them. It's only going to set up more barriers. Social identity is a major source of strength and superiority. And so resistance that people have can potentially prevent information from, let me re-say this, the resistance that people have to hearing can prevent them from having the intended response to what we are trying to get across. So if I'm citing science, their resistance may prevent them from even hearing the science that I'm trying to say. Next, please. So we have to remember that social networks help to form or reinforce beliefs. And if we, as health professionals, attack those beliefs, we lose the ability to persuade. That's really the take-home message from that last slide, which admittedly is a little confusing. Next, please. So what do we want to do while we're trying to talk to people? We want to ask them, ask what they understand, ask what they think, ask what their concerns are, and listen to their responses. There are data, at least for physicians, that when physicians ask a question, and these are adult physicians, not pediatricians, they typically wait only many seconds before they start talking. We want to have people be able to explain what they're saying and then to keep asking them to tell us more. We want to use body language, lean into the patient when you're talking to them. Of course, maintaining social distance if that's what you're doing, but use body language. Don't be at the same level. Don't stand above them. Use your hands use, if you're wearing a mask, use your eyes to be able to get your messages across. When you're hearing things, keep checking back with the patient. Am I understanding you? Is this what you're saying? This is what I'm hearing. Is this what you really mean? And summarize it. But at the same time, affirm what's being said. If a parent is really anxious, you can say, I hear that you are really anxious about this, that you're really worried. And you can say, I would feel better knowing that your child was protected against measles, against whooping cough, against HPV. You can tell stories. If you've seen patients with whooping cough, with pertussis, you can tell the family that you're talking to who's anxious, I know how bad it was. I saw that child in the intensive care unit on a ventilator, and I don't want that to happen to your child. Or HPV, I know people who have had cervical cancer or abnormal pap smears, and it's really been a challenge getting to the clinic, having all of those tests, being anxious. If it's having cervical cancer, getting treatment, it may be too late. So we can use our own stories to help get that message across. Next, please. We want to seize that moment. We want to be able to take that opportunity. And we don't want to bundle. It's not a bad family or an irresponsible parent who decides to not vaccinate. I may think that that particular act is not as responsible as I would want, but that parent is trying to do what they think is best for their family, for their child. As I've said, bundle the recommendation. Don't pick one vaccine as being more important than others. Ask for questions. And if it's a child who's old enough to ask questions on their own, certainly teens, and sometimes younger kids. Now, I have never met anybody who wants to have an injection. I used to say that if a kid came in and said they wanted shots, I would make arrangements to have them see a mental health professional, because that's just so atypical. But kids are hearing things, kids are understanding. When parents are on the fence about a vaccine, sometimes an adolescent may say, well, I don't want to have all those ugly warts on my penis. I want the vaccine. And that gets the message across. When parents ask questions, address them accurately and calmly. We can be rushed, but let's not get angry at the family. Let's not get snippy. We need to bring them along and show them that we care. And there's invariably a second question. Often some people say, or I read on the internet, and I can't tell you how many I read on the internet or I saw on the internet, but stay positive and try to address what you can. And again, show that caring. I would feel better if your child were protected. I know you want your child to grow up and be healthy. And I know that having this vaccine will help them on that path. Next, please. Many parents simply accept a recommendation, as I said earlier on, but some need reassurance. Some parents may be interested in vaccinating and have questions. And what we want to do is interpret that question as though, as they need additional reassurance from you, the health professional, that they trust with their child's health care, and ask what their real concern is. Make certain that you're addressing their absolute concerns, not what you think their concern might be. Next, please. So working with vaccine hesitant families, again, and I know I keep saying this over and over, we want to provide clear and concise messaging. We want to redirect misinformation. We don't necessarily need to correct every erroneous concept, but we want to redirect it. We want to help build confidence in those who do have questions. And remember that questions and concerns are perfectly reasonable. And we want to be able to know that our families are thinking and asking and weighing information. We want to align with the family and find commonality. I know that you want to do the best thing you possibly can for your child. That's why you're here today, and I'm so glad. So let's try to work together. And all communication needs to be proactive, empathetic, and transparent, and tailored to each family. What works for one family may not work for another. And make that personal recommendation for that vaccine, or for those vaccines if it's many. Next, please. This is a somewhat complicated sort of diagram to show the different parts of behavior that are core principles for addressing not just vaccine concerns, but really all health messaging. And I think this can be useful as you're talking amongst yourselves, as you're having a discussion in your offices about what some of the overlapping concepts are. We've talked about empathy and respect and transparency. We also want to talk about equity, that everyone has access to vaccine. These are core principles, and the outer circles are some of what we've talked about: providing tailored and consistent information, communicating clearly and repeating yourself, acknowledging and addressing concerns, trying to influence or engage the influencers and trusted messengers. This might mean working with an elder in the community, or working with a local pastor or minister or leader, some other leader, offering common sense, practical solutions. All of these things come into play as we're talking about vaccines. Next, please. Now, it's really important that everybody in the group has the same message, because if there's one person in the vaccine world that we're dealing with, and it's more so in an office, if somebody, the nursing assistant, the front desk person, the nurse, a nurse practitioner, even the doctor, doesn't really buy into what we're saying about the importance of vaccines, the whole thing will fall apart. And I love this shirt. It says, "Vaccines cause adults." You know, it's stretching it, but you get the point. Vaccines are good and help us grow. One of many reasons that we can live to grow to our full potential. Next, please. And you know that there is aggressive media attention to the concerns of the vaccine anxious, and there's a lot of discussion focusing on vaccine hesitancy in the anti-vaxxer populations. But we need to understand as well that social determinants of health, and in particular barriers, access barriers, play a large role in children not being up to date with vaccines, and you play a big role with all of this. Next, please. I live and work in New York City. Everything is very close by. You can get anywhere. We have great public transit. We have great public clinics. It's really easy to get around here. Other issues may be literacy and health literacy, being able to understand the message about health concerns, whether it's language, translation service, comprehension. And you probably know that using a child to translate for a parent is not the ideal circumstance. What about transportation? You're dealing with wide open spaces. Is there access? Is there public transit systems? You're dealing with location, rural health, suburban health, urban health, and how far is it to primary care or community-based care? What about insurance status for childhood vaccines? Vaccine for Children program, but if somebody doesn't qualify for Medicaid, do you have to refer them to a federally qualified health center? How does all of this play out? Immigration status may play a part as well. And for some people, fear of the public charge. If you have questions about public charge, we can talk about that later. Family structure and dynamics. Is it a single parent family? Do they have parental time off when you can access vaccines? Do you have to take everybody out of school so the parent can, get to a clinic and we don't have a problem with a child being left at a school after school time or trying to juggle everybody? And as well, having very easy excuses to avoid vaccines. Here in New York, we only accept valid medical reasons to not vaccinate for school vaccines. We no longer accept claims of it's against my religion or I don't believe in it. It has to be a valid medical reason to avoid vaccines. Things may be different. I know things are different in Nevada. Next, please. And I want to remind you, as you probably already do, that all vaccines should be reported to your immunization information system. And that includes as well any historical vaccines that child may have had, either out of state or even out of the country. Immunization information systems are really important. I've been working with them for 20 plus years. Next, please. I have provided a list of resources for you. So you'll have access to the slides. You'll be able to get to these. Next, please. There is a free CME influenza course that you are welcome to avail yourselves of at the Academy of Pediatrics. Next, please. And I want to thank you, and I welcome all of your questions. And it's really been a pleasure to have this opportunity to present this, and I hope we can now have a good conversation about vaccines. And Leanne, are you going to take over?
I am. So while we're giving folks an opportunity to post their questions in that Q&A box at the bottom of your screen, We will just review some last minute housekeeping items. If you've requested, again, continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen after today's webinar or in a post-webinar email tomorrow. Those CE certificates will be emailed out within the next week. Also, again, if you'd like to review or share this webinar, the recording will be available on the Immunize Nevada website, along with information for future webinars. We do have one more webinar as part of our American Academy of Pediatrics Visiting Immunization Expert Initiative that we will be hosting next month as well, in addition to just our general monthly webinar topics as part of the Nevada Immunization Learning Exchange. And so please visit immunizenevada.org/NILE-webinars for those details. Additionally, if you have registered for today's webinar, you will be added automatically to our list of potential trainings that are upcoming. You may unsubscribe at any time, but it's just an easy way to gain access to the latest opportunities that are made available through Immunize Nevada. So Dr. Palevsky, it does look like we have a few questions that came in the Q&A box. The first one came, what specific cultural variances have you found within vaccine hesitancy?
And I too am seeing the Q&A box. So Natasha, thank you for this question. There are times when, and it may be more of an issue, and this is my ignorance about the populations of Nevada. In New York, we have a very large immigrant community. So we will see people who come, say, from Eastern Europe. And there's a lot of misinformation, and I'm not casting any aspersions on any cultural group. I'm just picking this one as an example. But people who have distrusted the country leadership, or have in the former Soviet Union states, don't typically want vaccines, and the entire community doesn't get vaccinated. And so the families will say, well, where we come from, we don't believe in this. Okay, so that could be one. Another is if you have people who are, and this is, let's say somebody who's an observant Muslim or an observant Jew, people who avoid pork in particular, and they're concerned about, is there contamination, in quotes, of vaccine because of pork products. And that one, some of the live virus vaccines, MMR and varicella, there is, in the early development of the vaccine, there is some porcine serum that's used in it. There is no pork in the final product. The vaccines have been, I hate to say blessed, but approved by imams and rabbis so that it's okay. And we would say that if you needed a porcine heart valve as for heart surgery, you wouldn't not get the heart surgery. You wouldn't not get open heart surgery with a valve replacement because it was from a porcine valve. So that's an example of a specific cultural variance. There are many others. I see Juliet, I'm sorry. I guess I have mispronounced, it's Nevada. I apologize. I'm a New Yorker, what can I tell you? But I will try to make it correct.
We forgive you. You're absolutely fine. Just happy to have you here to present today. The next question we have is part of the Q&A. I know we had some, that was part of the chat, yeah, personally to you and I, but Griffin had asked, you mentioned the response to misinformation being redirection rather than countering. Could you please elaborate?
Sure. So if a parent says, well, I know that HPV vaccine is terrible and it makes you walk backwards. Now that was something that was on the internet early on. And, you know, rather than countering that, you say, no, it doesn't make you walk backwards. I might say, well, I know that is on the internet, but we have not seen that. And among all of the patients that I have already vaccinated, this has never been a concern or a problem. What's another one? Flu vaccine is gonna cause the flu. I bet you've heard that. If I get the flu shot, I'm gonna get sick from the flu vaccine. And so instead of saying no, I might redirect and say, I hear that a lot. And flu vaccine is made, if I try to grow flu from the vaccine, nothing will happen. There's nothing live in it. So yeah, I'm countering that a little bit, but I'm not just saying no. I'm trying to provide additional information. For each question, you find a way to respond with steering the direction differently. I hope that helps, Griffin. If not, please put another question in and I'll see if I can do better. I see Emily has said, what do I think perpetuates anti-vaccination attitudes in parents? Oh, that's a loaded one. I could spend hours talking about that. I think that people who are truly anti-vaccine live in communities of like-minded individuals, and they're not necessarily interested in hearing anything different. They've got their minds made up. They believe in their own theories. I don't believe in theories. I believe in science and proof, but that's not going to be a useful answer to somebody who's got a theory. And what we often see is these folks live in their own bubble of anti-vaccine. They spend all their time on the anti-vaccine websites. And it's interesting to see someone, there's a wonderful website called PKids, Parents of Kids with Infectious Disease. I didn't include it. I can send it to you after and you can share it. This is an organization of families who have been affected by these vaccine preventable diseases and now understand and have come around to wanting vaccine and sharing the message the vaccine is important. But I think that, you know, I'm old enough to have started practicing medicine before we had so many of these vaccines. And I unfortunately saw far too many children die of meningitis that's completely preventable or die of chickenpox. And most people don't think chickenpox is a big deal. I had patients who died of chickenpox. In fact, I had a childhood friend who died of chickenpox when I was about 7 years old. These diseases can kill. And, you know, we've forgotten how serious they are because we've virtually eliminated them. And we're dealing with this now with HPV, let's say. I don't think there's a parent, particularly a mother, who would want their daughter to have cervical cancer. I mean, the anxiety of going for an annual pap smear, that's not going to change. But HPV prevents 90% of all cervical cancer. If I could decrease the risk of anybody getting cervical cancer by 90%, boy, I'd want it. If I could assure myself that I would have a 90% chance of winning the lottery, I'd be thrilled. And that's sort of what that is. So I think people who are anti-vaccine just live in their own worlds and have that reinforced. Are there other questions? Because I'm not looking at the Q&A box.
That's okay. That's what I'm here for. Rachel has a question. Is there any data yet about how parents are feeling about getting their kids vaccinated with the new Pfizer COVID-19 vaccine?
That's a very important question. I think there are data, and I think it's all over the place. It certainly is in my local newspaper, which is the New York Times. But I think that parents are generally divided. Families who want their kids to be able to go back and do things and are generally pro-vaccine, are rushing for vaccine. There's been just a huge surge of families that I know reaching out for vaccine. In my area, vaccine has been provided to these huge state vaccine clinics or large vaccine clinics and pharmacies before it's been made available to pediatricians' offices. So families are rushing to these sites. There are other families who generally are vaccine hesitant. And in the same way that we see all kinds of bizarre theories, there are no microchips being implanted. That's one that we're hearing. But I think it's all over the place. I'd ask, what are you seeing in Nevada? What are you seeing about families for children 12 and up looking for vaccine?
I think in Nevada, we're really fortunate that there is, at least in our urban areas, I'll say, there is great access to locations where individuals ages 12 and up can receive Pfizer vaccine, especially as part of our retail pharmacy chains. But we do see that it's pretty split. I know that the emergency use authorization language just gives some parents some pause. They're waiting for that official licensure that does, that is meaningful to some. Also, we're just doing a lot of trying to not perpetuate some of that information about, it's not necessary for younger children, as this is COVID-19 primarily impacts older adults. It doesn't mean that COVID-19 is without risk for younger individuals. And so we're just trying to do our best to address that messaging for parents. We will be having some more resources that we have available. I'll also include a resource that we recently developed, basically a one-page sheet that's everything that parents need to know about the COVID-19 vaccine for adolescents, or the Pfizer product specifically. So we can include that as part of the recap as well. but it is pretty split. And I think that it's unfortunate, especially that COVID-19 was politicized to begin with. And so we're definitely seeing that line of divide carry through to adolescence as well. So
I would certainly agree with all of that. And I think that one of the driving factors for COVID vaccine is if people, for adolescents, colleges may be requiring it in order to be on campus. And, if you want to go to certain places, those, if you want to go on a cruise, if you want to go on a particular vacation, it may be required. But I think that, further discussion about the Pfizer vaccine is beyond the scope of this presentation. I'm sure that, if there's interest, well, this grant doesn't cover it, but the Academy has lots of information about COVID vaccine and kids.
Yeah, it's definitely a topic that Immunize Nevada will be exploring in the very near future. We've reached out to a couple speakers to address that topic. So today's attendees can be on the lookout for that opportunity as well very soon. Well, Dr. Palevsky, we are at the top of the hour. We appreciate your coming to present to us today. I think it's safe to say everybody walked away with a little bit of something that they were not able or didn't know previously. If in the event that your question did not get answered as a part of today's live presentation, we will be passing these questions on to Dr. Palevsky after today's webinar so that they can be addressed. We do appreciate everyone who is able to tune in today and hope that you will join us for next month's Nevada Immunization Learning Exchange webinar. Thanks again, Dr. Palevsky.
Thank you so very much, and please all be safe.
Okay, thanks everyone.